I'm Dr. Evelyn Reed. Do you constantly feel short of breath? Is there a nagging worry that it could be something serious? That tightness in your chest? That cough that just won't quit? The way a simple flight of stairs leaves you completely winded? It's more than just physical. It's a weight on your mind, a constant hum of anxiety about what it all means. But here's the thing. While a diagnosis of chronic obstructive pulmonary disease, or COPD, can sound scary, it's a condition you can manage. This isn't a story about losing control. It's a story about how you can gain it back. Together, we're going to break down what COPD is, what causes it, and most importantly, give you the tools and the confidence to take back control of your breathing and your life. So let's start at the very beginning. What exactly is chronic obstructive pulmonary disease? The name is a mouthful, so let's demystify it. COPD is a common lung disease that, thankfully, is preventable and treatable. It isn't one single illness, but really an umbrella term for a group of diseases that block airflow and make it hard to breathe. The two most common culprits under this umbrella are emphysema and chronic bronchitis. To get what's happening, picture your lungs as two big branching trees. Your windpipe is the trunk, and the airways are the branches, called bronchial tubes. At the very end of the tiniest branches are clusters of tiny, stretchy air sacs called alveoli, like little bunches of grapes. When you breathe in, air fills these sacs, and that's where the magic happens. Oxygen moves into your blood, and carbon dioxide gets passed back out to be exhaled. It's a beautiful system that powers your whole body. Now, let's see how COPD disrupts that system. With chronic bronchitis, the lining of your airways, those branches, is constantly inflamed and irritated. Imagine a low-grade fire smoldering in the branches of the tree. This inflammation makes the airway walls swell up and causes your lungs to produce way more mucus than normal. This sticky gunk can clog the airways, making it tough for air to get through. This is what causes that persistent phlegmy cough, often called a smoker's cough, that many people with COPD know all too well. With emphysema, the damage happens deeper, down in those tiny air sacs. The inflammation weakens and eventually destroys the delicate walls between the sacs. So instead of millions of tiny, elastic bubbles, you're left with fewer, bigger, and floppier ones. This causes two big problems. First, there's less surface area for oxygen to get into your blood. And second, the damaged sacs lose their springiness, so they can't push old air out when you exhale. This means stale air gets trapped, leaving less room for fresh oxygen-rich air to come in. This trapped air is a major reason for that feeling of being so short of breath. For most people, it's not just one or the other. COPD is usually a mix of both. The end result is the same. The flow of air is blocked, and it feels like a constant effort just to breathe. It's like trying to breathe through a pinched straw. That feeling of not getting a full, satisfying breath isn't in your head. It's the physical reality of what's happening inside your lungs. And it can turn simple things, like walking in the park or playing with your grandkids, into huge challenges. This often leads to a frustrating cycle. You avoid activity because you don't want to get breathless, but that makes your muscles weaker, which makes you more breathless when you try to do anything. It's a tough cycle, but it's a cycle that can be broken. So what causes all this damage? When people hear COPD, their minds usually jump to one thing: smoking. And it's true. Smoking is the #1 cause. In developed countries, smoking is linked to more than 70% of COPD cases. The thousands of chemicals in cigarette smoke are brutal on the lungs, weakening their defenses and causing the chronic inflammation that destroys lung tissue. That's why COPD is often found in people over 40 with a history of smoking. But here's something that gets missed all the time. You do not have to be a smoker to get COPD. Up to a quarter of all cases happen in people who've never smoked a cigarette in their life. This is a critical piece of the puzzle because it means millions of people could be at risk without even knowing it. So, what else is at play? Long-term exposure to other things that irritate the lungs is a major factor. This includes secondhand smoke, but also things at work. Occupational hazards are a big one, linked to a significant chunk, around 15% to 20% of cases. If you've spent years breathing in dust from things like wood, coal, or grain, or have been around chemical fumes and vapors, that can cause the kind of long-term lung damage that leads to COPD. Even the air inside our homes can be a risk. In many parts of the world, indoor air pollution from burning fuels like wood or coal for cooking and heating in homes without good ventilation is a primary cause of COPD. Then there's genetics. A rare condition you can inherit, called alpha-1 antitrypsin deficiency, or AATD, can lead to COPD. Alpha-1 antitrypsin is a protein that protects your lungs from damage. If you don't have enough of it, your lungs are much more vulnerable, and you can get COPD at a much younger age, even if you've never smoked. Your personal health history matters too. Having asthma as a kid can increase your risk later in life. So can frequent or bad respiratory infections when you were young, which can affect how your lungs develop. In fact, new research shows that for some people, the groundwork for COPD can be laid very early on, even before birth, leading to smaller airways or less lung capacity in adulthood. The main takeaway here is that while smoking is the biggest player, the story of COPD is way more complex. It's a disease caused by long-term irritation, and that irritation can come from many places. Knowing these risks is the first step. If you have a cough that won't go away, you get winded easily, and any of these risk factors sound familiar, smoker, or not, it's time to talk to your doctor. Living with unexplained breathlessness is scary. Every time you have to stop to catch your breath, the questions pop into your head. Am I just getting old? Am I just out of shape? Or is it something worse? Getting a clear diagnosis is the single best way to move from fear to action. It replaces what if with what's next. The signs of COPD often sneak up over years, which makes them easy to brush off at first. The most common ones include shortness of breath, especially when you're moving around. That slowly gets worse. A chronic cough, which might be dry or might bring up mucus. Wheezing, that high-pitched whistling sound when you breathe. Chest tightness, a feeling like a band is squeezing your chest. Getting sick often with colds or the flu that seem to hang on forever. And just a general sense of being tired all the time. Often, the wake-up call is when daily life gets hard. One person recalled first noticing it when carrying his son, thinking his son was just getting heavier, not that his own lungs were getting weaker. If these kinds of stories sound familiar, it's a signal to get answers. So, what's the diagnosis process like? It starts with a conversation. Your doctor will ask about your symptoms, your family's health history, and, most importantly, your exposure to risks like smoking or workplace dust. Then, they'll do a physical exam, listening to your lungs with a stethoscope. But the test that really seals the deal is a simple, painless breathing test called spirometry. This is the gold standard. For this test, you'll take the deepest breath you can and then blow out as hard and fast as you can into a tube. A machine called a spirometer measures how much air you can blow out in total, and how much of that air you can get out in the very first second. A COPD diagnosis is confirmed when the ratio of those two numbers FEV1 over FEC is below a certain point, usually less than 0.7. This shows that your ability to quickly get air out of your lungs is limited, which is the hallmark of the disease. The results also help your doctor figure out how severe your COPD is, grading it from mild to very severe. Your doctor might order other tests too. A chest X-ray or CT scan can rule out other problems and show changes in the lungs that point to emphysema. An arterial blood gas test checks the oxygen and carbon dioxide levels in your blood. And if they suspect the genetic type, a simple blood test can check for AAT deficiency. Getting to a diagnosis can feel like a lot, but it's the most important first step. Knowing exactly what you're up against removes the guesswork. It gives you and your doctor a clear target for treatment and a roadmap for moving forward, so you can breathe better, feel better, and get back to living a fuller life. Getting a COPD diagnosis can be a heavy moment, but it's also the moment you start to fight back. While there isn't a cure for COPD right now, it is absolutely a manageable disease. The goal of treatment isn't just about your lungs, it's about improving your entire quality of life, easing your symptoms, and helping you get back to doing the things you love. Let's look at the key pieces of a solid COPD management plan. Everything else is built on this. First, and this is the big one, if you smoke, quitting smoking is the single best thing you can possibly do. It's the only thing that's been proven to slow down the disease and stop more damage from happening. It's not easy, we know, but there are more tools to help you quit now than ever before. Talk to your doctor about cessation programs, nicotine replacement, and medications. Quitting is a powerful investment in yourself. Second, avoid lung irritants. Stay away from secondhand smoke and pay attention to air quality reports, dust, and strong fumes from things like cleaning products that can make your symptoms flare up. On bad air days, it might be best to just stay inside. Third, get your shots. People with COPD are more likely to get seriously ill from respiratory infections. Staying up to date on your annual flu shot, pneumonia vaccines, and COVID-19 boosters is a huge part of protecting your lungs from an infection that could cause a major setback, called an exacerbation. COPD medications mainly work by opening up your airways to make breathing easier. The foundation of treatment is bronchodilators. These are medicines that relax the muscles around your airways, helping them open up. Most of them are delivered through an inhaler. Short-acting bronchodilators give you quick relief when you're feeling breathless. Think of this as your rescue inhaler. Long-acting bronchodilators are used on a set schedule, usually once or twice a day, to keep your symptoms under control and prevent them from happening in the first place. For some people, especially those who get frequent flare-ups, your doctor might add an inhaled corticosteroid. These reduce the inflammation in your airways. Often, these are combined with long-acting bronchodilators in a single inhaler, and there are always new treatments on the horizon. For some patients with severe COPD, biologic therapies might be an option to reduce exacerbations. In cases of very severe COPD, where your blood oxygen levels are too low, your doctor might prescribe oxygen therapy to make sure your body is getting the fuel it needs. This is where you become the star player on your own healthcare team. One of the most powerful treatments that doesn't involve medicine is pulmonary rehabilitation. This is a program run by medical pros that combines exercise, training, education, and breathing techniques. It might sound weird to exercise when you're already short of breath, but making your body stronger helps it use oxygen more efficiently. This actually reduces breathlessness and makes a huge difference in your quality of life. Learning specific breathing techniques can also help right away. One of the best is pursed lip breathing. You just breathe in slowly through your nose, then breathe out slowly through tightly pressed lips, like you're about to whistle. This simple trick keeps your airways open longer and helps you empty your lungs of that trapped, stale air. Nutrition is also important. A healthy, balanced diet gives you the energy your body needs to breathe and stay strong. Finally, managing COPD also means managing your emotional health. Living with a chronic illness is tough, and it's normal to feel anxious or down. Building a support system with family, friends, or even a support group can make all the difference. Talking to others who really get what you're going through is incredibly powerful. Living well with COPD is an active choice. It's about taking your medicine, going to your rehab sessions, practicing your breathing, and talking openly with your doctor. Every single one of those steps is an act of taking back control. The journey with COPD is a marathon, not a sprint, but it's one you absolutely do not have to run alone. The most important next step you can take is to use what you've learned here to start a conversation with your doctor. Together, you can build a personalized plan that works for you. While COPD is a part of your life, it does not have to be your life. People with COPD live full, active, and amazing lives every single day. With the right treatments, lifestyle changes, and a proactive mindset, you can manage your symptoms, breathe easier, and get back to the things you thought were gone for good. You have the power to change the course of this disease. You can take back control. If you found this helpful, please consider subscribing for more content to help you manage your health. Remember, the path to breathing easier starts with knowledge and action. You've already taken the first step.